Are GPs missing out by not doing clear aligners, not doing more clear aligners? It's Dr. Nacho Goodman, talking with one of our amazing sponsors, someone who helps the dentisting world smile more and cry less. Introduce yourself to the audience and tell us what you do to help dentists.
All right, this is Dr. Elon Abramowitz. Short is Dr. A. I created Perfect Fit Ortho with the simple goal of helping patients get the best quality clear aligners they possibly can under the monitoring of their trusted general dentist, because that is the primary caregiver for our communities.
I love that.
Yep,
Let's unpack this a little more, and I have some
sure.
context. So you're an orthodontist, and
Yes,
you are someone who does not have to, you know what, know why you're lucky? You ever thought about this? You don't have to make anybody numb. When was the last time you injected somebody? It's pretty nice, right?
it's very nice.
Yeah. Um, and GPs, I'm a GP. I happen to learn a lot with dental implants as a general practice resident, but I still would rely on bigger, stronger specialists to help me with implant cases. But I couldn't call them up in the middle of an implant case and FaceTime them and say, does this implant look right? And it sounds to me like you have created this golden opportunity for GPs to go out of their comfort zone, do more ortho, but also know that someone has their back. Am I listening to that correctly?
Yeah, absolutely. In fact, it's basically like they're bringing in an orthodontist, I would say, into their office. It's kind of like a virtual orthodontist consultant. We provide the service of doing everything that an office could possibly need for orthodontics, as far as doing the exam, helping with the treatment cell, financial options, treatment coordinator. Then we've got the case set up for them with the aligners and monitoring of the case. And then we have orthodontists with them the whole way through treatment, so the doctor can communicate with us or we can communicate with them to make sure that the treatment of the patient runs perfectly smoothly, just like they would in an orthodontic office.
I love that. I mean, it's something that, you said something when we started. Kind of tell me more about that. Why is it so important, whether it's their role in the patient's life, whether it's sometimes patients don't want to go somewhere else, that the GP is trained better in this, can do more cases with the help of Perfect Fit, but also just as an orthodontist who probably loves people getting ortho, more people in our general population having straighter teeth.
Absolutely. So this whole thing started for me with the change in technology and really AI, right? And we had this company called Smile Direct come out. And while my profession was trying to, file lawsuits against them, I said, well, they're doing something right. So let's look into it. So I became a patient. I went through the process. I learned everything. I learned what they do. I learned what they do wrong. It matched orthodontic. What you have to realize is the patient will make their choice. And convenience and affordability was the number one factor in their explosion. So, what I did through myself, I said, what can I do to make it convenient, affordable, and yet give quality treatment? And through the evolution of AI into orthodontics, I was able to create a system that lets me monitor these patients literally weekly through an app on their phone, and at the same time provide them with the aligner care that I was able to learn from some of my mentors who showed me how to
Yeah.
treat any case with aligners. And we can put that all together, and I can offer that to the dentist so they can take care of their patients, not let them fall into the do-it-yourself market, and not worry about, let me tinker with this a little here and there.
Yeah.
We can allow them to go all in with the help of an orthodontic consultant.
I love that. Walk me through, what Dental Nachos does really well, Elon, is like my first stuff, my first implant, my first sleep
Okay.
apnea. So let's just talk to the dentist who doesn't do any aligners and is just thinking,
Okay.
I bought a practice, I'm doing restorative dentistry. I think it would be great to offer aligners to my patients, but I'm worried about the cost, the implementation. I'm that dentist. Walk me through,
Okay.
how do I communicate with Perfect Fit Ortho and tell me about the process?
Easy. Come on our website, perfectfitortho.com, schedule a meeting. We can answer any of your questions. We'll walk you through the whole thing. Now, if this is your first time, that's great. It was once my first time doing it. And you know what? Now I can treat any case. So come on in, just talk to us. We'll start with the cases that you feel comfortable with. We can walk you through the step-by-step process from doing a virtual exam. How do you do it? Well, simple. We'll show you how to take the pictures on the app we create so that our consulting firm will offer you the estimated treatment time. We've gone over the fees for you before you've integrated that app. All right. So you'll know the fees. We'll give you the feedback for how long it takes. We'll help your patients sign on. We'll show you before you start how to do the scan of the STL file. We'll go over any aligners that you use or interested in using or would like to try. And we'll set you up through the whole process. And it really only takes, literally, it's about a 1 hour meeting,
Nice.
And within 3 days, you're usually totally set up and ready to go.
I love it. Now, we do a lot of before and after photos that we show to patients, whether it's full mouth rehabs, whether it's ortho or implants, but I don't think we do enough before and after of dentist transformations. So, who is a dentist? You don't have to say their name, but I say who's like, came to you with probably skepticism. I can never do this. This is never going to work out. But now they are a champion of clear aligners. They're so glad that they went out of their comfort zone. Do any dentists like that come to mind?
Absolutely. I've actually got a couple videos and we will make sure we post them on Dental Nachos in the coming days so you guys can see it.
I love that. As someone who is a dentist, we're both dentists and we're helping transform the lives of dentists. Just what is the impact right now? I know we talk about patients and I know we talk about teams, and dentists are supposed to make them feel great, and we are. But who's supposed to make the dentist feel great? So tell me, what are these dentists, whether they're associates or owners, what makes them feel great about this? Whether it's about the profitability, whether it's about the patient smiling. Tell me more about that.
Okay, so it really depends what you want to do. So some dentists love it for the profitability. Yeah, I won't lie, they love it. Some people love it for the convenience that they're able to offer this service without bringing in an orthodontist anymore. Now the clear aligners are done by themselves with our service through Perfect Fit Ortho. Some love it because they're able to add just a service that they always wanted to do. They just didn't
Yeah.
want to spend that time doing the cases. That 30, whatever, 40 minutes it used to take them to do it, it's done in a matter of minutes because they just submit it to us and we take care of the work for them.
Love that. And I mean, one of the things I'll share is, I know dentists aren't supposed to talk about fees and things like that, but I'll just kind of create a framework. I tell people if I was walking down the streets of Philadelphia and someone said, "Hey, what's an implant supposed to cost me?" And I'd say, start to finish, a back tooth implant, if you hear a range between $4,500 and $7,500, that's a pretty normal range start to finish, right? If you hear something a lot lower than that, I'd ask questions. If you hear something a lot higher than that, I ask questions. I don't know nearly as much about ortho. But like, and I know we have 50 states, but like, what's a range for these cases that offices are charging? 4 to 6, 5 to 8? Tell me about that.
Sounds just like you said. I'd say down, there's some that charge 4 and some will go as high as 7. And here's the beautiful thing with Perfect Fit Ortho. We've cut down your treatment times to literally 2 visits. It might just be the start and the finish. So if you charge 4 grand on that case, that's $2,000 per visit. I mean, you can't beat that.
Yeah. And also as general dentist, I mean, you were, I know that smarter in many ways to sign up to not numb patients, right? But I think if you're a specialist and if you don't work in a general dentist office, you don't realize how much running around from room to room to do and how much brain switch we have to do. Class 2 composite implant crown. So it's kind of, I imagine it's really nice to say, hey, I'm just gonna, I don't want to call it a relaxing thing. Maybe it's right to call it, but it's something where I think dentists really enjoy. They don't have to always pick up a handpiece. They don't have to make somebody numb. They get to use kind of part of their dentist mind they don't get to use all the time. And I imagine that that's pretty rewarding.
I bet it is. And the other thing they love is it takes away patients from coming into that office and hogging chair time, right?
Yeah.
So you might not want to spend time figuring out ortho on the spot when you've got all that other work to do. Now you don't have to do it because we've taken care of it and they don't have to come and use up your chair time anymore.
Love that. Well, people in our community can text perfect to 215-543-6454 to learn more about Perfect Fit Ortho. They can go to perfectfitortho.com. Elon, I so appreciate you sponsoring and supporting our group. Is there anything else you'd like to share with our audience before we wrap up?
You know what? I'm excited. I say here's the one thing that we do because there's a lot of companies out there. Ours, number one, is agnostic. Keep your aligner, use it, enjoy it. And number two, try it. Like I said, there's so many of us out there. Give us all a try. Pick your favorite. Why? Because we all want you to take the best care of your patients that you possibly can.
Love that mission. Thanks so much for sharing with us today.
Thanks. I appreciate the time, Paul.